Myself, Dr. Jayanta Bhattacharjee. Presently, I am working as a diabetologist in the in Jivanjyoti Hospital, Silchar. Today, I want to talk to you regarding the regular blood test that we need to carry out for our health. As we are aware that there are number of diseases, both infectious and non-communicable disease. These are at a higher rate. So in order to catch them early, we need to screen for blood. A blood screening can provide a snapshot to your current health and catch the potential health problem before they can give rise to a fully developed conditions. But this is not enough. Once you have been diagnosed with certain disease, you have to go for a regular or periodic blood examination. Now let us see why it is important to do a regular blood test. Basically, regular blood testing is one of the most important ways to maintain the overall well-being. In fact, being tested at a routine interval may help you understand how your body changes to the different treatment schedule that you are being getting, and it becomes easier for the doctor to make a judgment on your health. So blood tests have a variety of uses. If one is experiencing unusual persistent symptoms like extreme fatigue, weight loss, or in fact weight gain, or if there is a new pain, blood tests can help to identify the cause of that conditions. Also, if wants to optimize their health, knowing the level of various health components such as cholesterol, we can modify our habits, our diets, and we can leave aside our unhealthy habits that may lead to some cardiac problems. Before moving on to the conditions that require regular blood test, let us discuss some of the informations that we may need to know prior to doing a blood test. Generally, majority of the tests, they do not require any preparations, but sometimes the doctors may advise you that you need to go for a fasting blood test. That time, at least a minimum of 8 to 12 hour fasting is required for regular blood test. So what are some of the tests that we regularly need to conduct in order to have a proper health? So one of the simplest diagnostic method, although this is not typically a blood test but is a measurement of the blood pressure. So this is a simple test which can be done either in the clinic or in the home, and there are the blood pressure that occurs is mainly because the heart they force blood against the arterial wall, which causes a pressures. Now there are two types of blood pressure that we commonly see. One is the systolic blood pressure, which is when the heart is contracting, and the other is the diastolic, when the heart is in the resting phase between the two beats. So ideally it is said that the systolic pressure should be less than 120 and the diastolic pressure should be less than 80. In fact, it is possible to measure blood pressures at home also by use of some Android monitors or by digital monitors. But normally we refrain from measuring the blood pressure either in the finger or in the wrist, as they do not give a clear measurements. So when we need to do the blood pressure and how many times? So again it depends upon the doctor, but ideally what we say that at least the blood pressure should be measured for 7 consecutive days, and each time the blood pressure should be measured once in the evening, once in the morning. Now ideally each time we take two blood pressure measurements. But if there is a greater variations in the reading between the two measurements, then we may go for a second or third or fourth reading. It is important to know that your blood pressure may go up or down depending upon your age, your mental conditions, your medications, or your heart conditions. So moving on, let us know about the regular blood blood measurements that we need to do is mainly your blood sugar. So why do we do a blood sugar? Just to confirm that whether a person is having a diabetes or not. So a diabetes is a condition where your body fails to secrete adequate amount of insulin, or or there is the insulin is secreted but is not acting properly. So, and due to uncontrolled diabetes, there may be number of complications that may arise. There may be complications of the eyes, of the heart, of the kidney, of the legs. There are numerous complications that may arise due to uncontrolled diabetes. So it is very much necessary that one go for a regular blood test. So the critical part of managing the diabetes is to routinely check your blood glucose. And how it can be done? It can be done either by checking your glycosylated hemoglobin, which is also known as the HbA1c. So the glycosylated hemoglobin is nothing but the average of the last 2 to 3 months glucose average that is been given. Normally the value should be less than 7. The other is the fasting blood sugar, where a person needs to be in a fasting state for a minimum of 8 to 12 hours. And the third is the oral glucose tolerance test. Here, after taking the fasting blood glucose, the person is given some sugar drink, and after an interval of 2 hours his blood sugar is checked. So normally what we say that your fasting level should be between 70 to 130, and your postprandial, that means after your you have taken a sugar drink, it should be less than 200. Again, this value depends upon the age and the presence of comorbidities. There are other conditions also when we can recommend for a blood glucose, is that if the person is having a high blood pressure, or if he is complaining of increased frequency of micturations, numbness in the legs, toes, or have got some heart problems, then also we can recommend for a person to go for a blood sugar testing. The other is what we look for is the blood cholesterol, or what we see as the lipid profile. Here we mainly look into the total cholesterol, the LDL, the HDL, and the triglycerides. So by looking into the cholesterol level, it gives an opportunity to look into what the condition of the heart is. So normally the cholesterol level, the blood cholesterol level should be less than 200 milligram per deciliter, and your LDL, that is what we called as a bad cholesterol, should be less than 130. But if that person is suffering from diabetes or having some other problems, we normally prefer to lower the LDL level to less than 100. And in case of highest risk of heart attack, we normally recommend to bring down the LDL level to less than your 70. The other lipids that we look into is the HDL. So normally this is what is also called the good cholesterol. That means they remove the bad cholesterol and prevent the bad cholesterol from depositing in the lumen of the blood vessels. So normally the value is that it should be more than 45 in males and more than 55 in females. The last but not the least, in the blood lipids that we look into is the triglyceride levels. So here, so the triglyceride is another type of fat, and a high triglyceride levels usually means that you are eating more and you are burning your calorie less. So there also a person having a high triglyceride level in the blood are also a risk factor for any heart disease. So normally what we say that the value should be less than 150 milligram per deciliter. So in the end, I would like to say the bottom line is that your blood offers many clues to your healthy heart, and they are also a good way to catch illness or disease early in the course of the disease. Therefore, I would like to suggest you that you should get your blood test done regularly, if not at least once yearly. Thank you.